decided to become a dentist when I was about 10 years old. And I used to go to my family dentist, and it was a pretty painful experience. And as the years went by, I thought, it doesn't have to be that way. So it became my mission to make it not that way. And from that age on, I was intrigued by what was happening there and what the dentist was doing. But I also just became overcome with the desire to make it as painless an experience as possible for my patients, and to give them a good experience when they would come into the office. Technology has been a huge thing. Back in the beginning, when I first set up my practice, computers, no, nothing of the sort. A few years into it, they came on the scene, and I remember somebody telling me one day, there will come a time when you'll have a computer in every operatory in your office. And I thought, yeah, right. There's nothing that I have to gain by having a computer in my office. It's not a production tool, it's just in the way. And by golly, you know, here we are in almost every dental office in the country. If you're up to it with being modern with technology, you've got a computer monitor in your operatories. So it's changed a lot in that regard. And things that we use in our office, CT scans, laser therapy, many things. It's technology is huge. It's huge, and it's made dentistry a much more exciting profession. In regard to the technology in making crowns for patients, you can come in and you can walk out an hour and a half later and have a crown on your tooth. That's a precision fit done by way of CAD/CAM and through a computer. We use cold laser therapy in our office. So someone comes in and has a cold sore, and the cold laser will help to make that disappear very quickly. There are issues in regard to pain relief. There are TENS units that we use. There's ultrasound units that we use that weren't available many years ago. Lots of things on the scene that can help solve that patient's issue, as long as although we have all the technology, and the technology is extremely important, but there is a common core here. In order to have the technology work for you, you've got to make the right diagnosis. That's key, and technology helps us to get there. In our practice, we have a tagline, mission statement that we use, and it's designing a better quality of life for you. And the things that we do, we want to help our patients to have a good experience when they're in the office. We want to have them leave feeling better than when they came in. We have to accomplish that mission. And when you're dealing with sleep apnea and TMJ problems, most of the time, a patient doesn't come in 1 hour later, they leave, and boom, they're cured. Their apnea is gone. Their TMJ problem's gone. You know, there's a commitment on our part and their part to work together to achieve a good result for the patient.